I love facelifts because it's such an aesthetic procedure and there's so much passion that goes into it and so much discrimination on a plastic surgeon's part, trying to get as close to perfection as we can. Contemporary facelifts should not have any skin pull whatsoever. The incisions should be imperceptible, so I want people to be able to interact and not have anybody know anything's been done. When someone comes in for a consultation for a facelift, a good candidate is somebody who has loss of contour of the cheekbones and feels like they have jowls and feels like their neck does not have the definition that they used to. Oftentimes, I will add a blepharoplasty, which is eyelid surgery that will help make the upper eyelids crisper. If in fact somebody has very deep wrinkles of the forehead, I will add a brow lift to that, usually which I perform endoscopically. So all those things can be combined with a facelift, and we say most commonly that since it's just one recovery, we like to do that all together if we can. After a facelift, generally we say the recovery is anywhere between 7 and 10 days. After surgery, we have people stay overnight in a recovery center right next door, and then generally people go home the next day. I think that the swelling that people are afraid of usually peaks about the 3rd day, and then after that, you start to see daily improvement and you'll see the contour, and by 2 weeks, I think that people feel amazing. With any surgery, there are inherent risks and possible complications, and they're incredibly rare. And those would be things like bleeding, infection, the risk of anesthesia, but risks are incredibly rare with facelifts. Anybody who's considering a facelift, I think they should get some different consultations, but at the end of the day, this is about going to the best person possible, and I think people should not shortchange themselves. If you want to get the best, you need to be coming here. I often see people within 6 months or a year from having another facelift with somebody else that are unhappy. So I see a lot of revision facelifts. I usually have people wait about a year so we can let all the swelling go down, but I really enjoy fixing them because I think they're some of the happiest patients that I see. My opinion, I think facelifts and rhinoplasties are the most technically demanding, and I love the fact that the little aesthetic considerations that I make, I always see the difference, and I think it makes that extra X factor that makes people feel and look so great, and I think that's why my before and afters look so good. I think it's the amount of work that I put in, I think pays huge dividends in terms of my results.